Hello, everybody. Happy Monday. We're coming off of a holiday weekend. It seems like it lasted forever with the holiday on a Tuesday. So hopefully you guys are getting back into the full swing of a full work week, and we are kicking off July strong by getting into a new series here with our Learn with Lo. So if you were following along, we really took June and talked about a lot of like a symptom series, right? Where it was a little bit more giving you guys a behind the scenes look of some of the most common symptoms that individuals come into practice to see me for, all the way from we got to discuss things like fatigue, chronic energy level issues, anxiety. We got to talk about brain fog. We got to talk about cravings, right? And so we got to really identify a lot of these symptoms that may be part of a bigger scenario that bring individuals into practice to work with me or to see me. But usually it's a combination of multiple symptoms altogether, which makes it more fun of a puzzle to kind of tease out. But really, I think the biggest take home factor that really sparked a lot of the conversations of marrying that symptom series into this new month was that a lot of times, especially women, tend to see maybe their primary care provider, maybe their OB, maybe a different practitioner in their circle. And I wanted to start to kind of have some conversations around, okay, if you were to take these same symptoms into maybe a different practitioner's office, what would be their solutions, right? I talked through what kind of like my protocols and where my headspace goes when I see individuals like this. But it's not always the same with every practitioner, right? So most of the time when individuals, especially women, would go into practice and kind of have things like, hey, I have anxiety, I'm having chronic fatigue, I'm feeling things like brain fog, I'm having anxiety, or I'm having some menstrual cycle issues, whether it's heavy bleeds, heavy cramping, what type of treatment strategies and conversations are they getting, right? And so most of the time what I've seen as a common denominator is that they're getting a lot of kind of band-aid solutions, right? They're getting a lot of the here's kind of a pill for every ill type of story or treatment strategy. And then unfortunate for them, they might take that with the guys that like, so I can take this and I don't have to make any changes, or it just kind of goes away, right? And there's not really a whole lot of understanding around what's the bigger picture going on here, right? What is the root cause? Where did these symptoms come from? And like I said, how did these symptoms kind of all fit together? Because it's very, very rare that one of those symptoms is going to happen in isolation. So we can't just spot treat with different Band-Aid solutions. And I think one of the most common ones is something like a hormonal birth control. So lately, I've felt like I've had lots and lots of really, really great conversations with women in all different walks of life, asking me about the role of hormonal birth control in their overall story, whether it's I had a gal reach out to me last week and she had gotten off of hormonal birth control about a year and a half ago and has had fertility issues ever since, right? So we get these women that are kind of given that message of like, oh yeah, just stay on hormonal birth control until you're ready to have kids, right? And then you come off of it and they make it seem like, oh yeah, you're just going to get pregnant instantaneously. And that's not the story for every woman, right? And that's usually because something like hormonal birth control might have been masking some issues that were there all along. And she just kind of used the hormonal birth control or was given the hormonal birth control to mask those, and now taking it away, those problems are still there. And now they're presenting a fertility problem, right, that we need to dig into. It's like, we probably should have dug into that way back when we first came in with some symptoms, right? So had conversations around that, also had some conversations with some current clients that are looking to transition off of hormonal birth control. So it's pretty common that I'll see ladies come in and maybe they're utilizing some sort of hormonal birth control at the time, and they know that it's kind of not the complete picture. They know that it's covering some things up, but what our role is not necessarily to like say that that's a good thing or a bad thing. It's like, hey, let's though support the system as a whole. Let's really go back to the foundations. And even if we are utilizing some pharmaceutical therapies, that's cool. That's fine. How are we optimizing the system with that stuff on board so that if in the future you ever wanted to transition off, you have a much smoother transition off because you've really set the foundation and kind of worked on some of those big things behind the scenes first. So helping some women really in that like supportive phase, either transitioning off of hormonal birth control or they're choosing to use hormonal birth control, which is fine and great as well too. And we just want to support the system as best as we can with that on board, right? So long story short, I felt like with so many different conversations and questions coming in, I get quite a bit of individuals really asking like, well, what do you think? Kind of like, well, what's your opinion, right? And I will tell you right now that I tend to be very unique in the fact that like, I don't tend to be dogmatic. I don't think that health is a game of black and white. I don't think that overall health is a game of extremes either. I think that lots of different things can coexist together, right? So my answer that everybody hates and loves at the same time is, my answer is honestly, it depends. Because I think that every woman does deserve 100% education, 100% informed consent on the pros and the cons and the risks and exactly what that hormonal birth control is doing from a mechanistic standpoint. But I also think that women have 100% complete autonomy over their body and what they feel like is the right move for them. So I'm more of that passionate educator where I'm going to come in just like I'm going to do today, and I'm going to hit you guys with some of the foundations, some of the basics, right? It's like, what is hormonal birth control? How is it acting in our body? What are we told about hormonal birth control versus what's really kind of like the true story of what's going on inside of our body? And I feel 100% confident that every single woman out there, if they are given the right education, they can make a decision for themselves, right? It's like, just give me the facts, right? Give me the facts and then let me noodle over it. Let me kind of weigh the pros and the cons for my unique scenario. And then I can judge or not whether that's the right move for me, or maybe I want to loop that in and I also want to work on some other factors as well too. So it doesn't have to be black and white. It does not have to be this world of like functional medicine over here where I'm anti-pharmaceuticals, but it also doesn't have to be completely Western or conventional medicine where it's just a pill for every ill and like you walk into a practitioner's office and you ask them about like, hey, is there any room or world in which like I could use and make some nutritional or some lifestyle adjustments to also tackle some of my menstrual cycle issues? There are conventional practitioners out there, because I hear from them all the time, where they blatantly tell their patient to their face, they're like, no, there's nothing you can do about it. Like, you just need this pill. And it's like, whoa, hard stop. Like I have a problem with that, because if there's someone that's inquiring or asking about like, hey, I kind of tend to be a little bit more natural minded. I would love, if possible, to understand like both sides. What are my options here to utilize nutrition, lifestyle, supplementation support, movement strategies, nervous system regulation? Like, give me both sides so that I can decide what's my perfect mix. Do I want to use some pharmaceutical and some functional, or do I want to use all pharmaceutical or all functional? I don't think that there is a black and white or a right or wrong. I truly think that health for each individual person is defined by living in the middle and living in the gray area. So that's what you'll hear a lot come through today as we tackle this big subject. Now, I'll try to get through as much today. If I need to make this a multiple part series, I will. I also want to talk about hormone replacement therapy, kind of on the other side of the coin, which again can sometimes be offered as kind of like a band-aid solution for women that are kind of transitioning out of the menstrual phase of their life. So we'll definitely talk about the hormonal birth control and hormone replacement therapy, because those two worlds can very much kind of coincide, right? So at least for today's purposes, let's kind of dive into this hormonal birth control conversation. I'll try to keep it as high level as possible, because I can't possibly fit in all of the specifics in our short time together, and everybody is different, but we'll at least go through like, what are some of the hormonal birth control options that are out there? What do they really do? What are some of the pros and the cons that we hear about, but maybe some that we don't hear about? And then we're going to end our time today really talking about options. I think that that's probably my biggest passion point, is like, we could do this or we could do this, right? Depending on your specific scenario, what's going to kind of be things that I wish that every practitioner were talking to their patients about, of just laying it out on the table and being like, we could go this way, we could go this way, or we could go this way. What feels right for you? That's the type of practitioner that I want to be, is laying it out there, and then together we can create that strategy that feels good for everybody. Okay. So let's start at the top, right? So when we think about birth control, I do feel like there's quite a few people that are kind of like waking up to questioning this birth control story. So when we think about hormonal birth control, that's what we'll really talk about today. There's lots of different methods out there, all the way from like a pill, like an oral contraceptive, all the way to various IUDs. They could let me even go back. So we have oral contraceptives, right? We have oral contraceptives in various forms. Some of them are what we call like combination pills, where they have synthetic estrogen and synthetic progesterone in them. There's also a class of oral contraceptives that they kind of call mini pills, and those are lower dose and they tend to be synthetic progesterone only. So those are kind of like the oral contraceptive versions, where you have more of a 28-day active pill pack, right? And you have 1 week that's more placebo pills, in which you would get a withdrawal bleed. Now, this is what we'll get into with like the pros and the cons. That withdrawal bleed, that is not a menstrual cycle. That is not a period, right? So I think a lot of practitioners, they always tell women, they're like, yeah, you know, this oral contraceptive, this is going to regulate your menstrual cycle. I'm like, there's no regulating the menstrual cycle. That completely shuts off the menstrual cycle. There's no ovulation that occurs, obviously, because we don't want to get pregnant. Like that might be one of our main reasons for seeking out an oral contraceptive, right? So it's like, we just have to be honest about like, okay, if we're using like a combination pill that has synthetic estrogen and progesterone, or we're using a mini pill and it's a progesterone or a synthetic progesterone only, it's like neither of those are supporting in any way or fostering the menstrual cycle. They are completely shutting it off. So let's not call it a period. Let's call it a withdrawal bleed is really what it is. So we're pulling those hormones out to mimic the drop that our body normally would, so that the uterine lining sheds. But the crescendo, or like the biggest moment of our menstrual cycle, is ovulation. So who cares about the bleed? Like that's just the uterine lining shedding, so that we don't build up a thickening uterine lining, which isn't great for things like cancer risk and overgrowths and fibroids, right? So we want the uterine lining to shed, but please don't be duped into thinking that like, oh yeah, I have a regular period, right? So if someone asks me, I see that they're on an oral contraceptive, and they check, they're like, yeah, I have regular menstrual cycles. I'm like, you don't have regular menstrual cycles. You don't have menstrual cycles at all, right? You're just getting a withdrawal bleed. And so sometimes I think that there's a confusion from some practitioners telling women that like, hey, take this oral contraceptive and you're regulating your period every month. It's very predictable. You know exactly when it's going to come. And it's like, there's no period that's happening. It is called a withdrawal bleed is what that is called. So it's simply shedding the uterine lining to make sure that the uterine lining doesn't build up, but don't be duped into thinking that you're having a period. You are not having a period. You are not having a menstrual cycle in any way, shape, or form, because you are not ovulating. That is the grand crescendo of why we want the menstrual cycle in the first place, right? So some pros and cons of those kind of oral contraceptive devices there. The other thing to know too, which I kept reiterating, is those are synthetic hormones. Those are not bioidentical hormones. They are synthetic versions of what your body makes. So you don't actually get progesterone in a oral contraceptive. You're getting progestin, which is very different. You're also not getting like bioidentical like estradiol. You're usually getting a synthetic version of the estradiol in those, right? Which is fine, but they're at very high doses, and being synthetic, they are going to compete with your natural hormonal production in that right? Which is why it shuts down ovulation. But don't think that those synthetic versions are going to have some of the same protective benefits that our natural hormones do. Like estrogen is really great for insulin sensitivity. Estrogen is really great for bone density and bone formation. So if we're just kind of flooding the system with exogenous synthetic estrogen, it doesn't have all of those same effects, right? So we're not getting like the total body benefits that like real progesterone and real estrogen really do for the body, right? So again, pros and cons. I'm just here to say like, hey, we can go that route. Just know that they're synthetic hormones. They're not the same thing. And they're also going to shut off ovulation, which then does prevent any menstrual cycle from happening. So we're going to call it more a withdrawal bleed, because you're not really having a menstrual cycle on these oral contraceptive pills. Okay? Totally cool. I think the last piece of the puzzle to know about the oral contraceptives comes with women that are kind of transitioning into more of like a perimenopause or a menopausal place. This has been another misconception where I've had some women come in and they're like, yeah, my doctor, my cycles have gotten like really heavy, really crazy, transitioning into a perimenopausal place. And my doctor wanted me to get on birth control to regulate the cycle, minimize those symptoms. And he said that I would need those hormones in menopause anyway. Excuse me? Like, hard stop. Like, there is nothing about an oral contraceptive that is a bioidentical hormone or in any replacement for the bioidentical hormones that you are going to be lacking in a menopausal picture. So don't let anybody tell you that like, oh yeah, hormonal birth control is the same thing that we get in a hormone replacement therapy. No. Very, very different. And you are not getting bioidentical hormones. So that is not what your body needs in a perimenopause or a menopause picture. Like, let's just be super clear about that. Not same thing at all. So that's where I think the pros and the cons of something like an oral contraceptive need to be weighed. Now there's a whole family too of your implantable devices that range all over the gamut of like inserting under the skin, more inserting into the vaginal wall, whether that's an IUD, copper IUD, hormonal, non-hormonal IUD type options. I would say the benefit of an IUD is that you do 50-50. Some women do still tend to ovulate on an IUD, which is great. That's kind of like the method to the madness. There is research to suggest that those hormones in those IUDs are supposed to stay more local to the cervix and to the vaginal canal. I can't imagine that there can't be some situations where those hormones also don't get systemic. So I'm not sure that all of the hormones are really just staying right there. So those are the pros and the cons there of like maybe more of an IUD scenario where you might actually ovulate, which is good, but you just wouldn't get pregnant then because of the localized hormones or because of how it acts in the union of the egg and the sperm. So all in all, I think that there's, like I said, some definite pros and cons of utilizing any form of birth control in that regard. I just always want to make it like super, super clear. I think some of the misconceptions, regardless of whether it's IUD or regardless of whether it's an oral contraceptive, I would say the most common things that I hear is my doctor told me that this would regulate my periods. It's like, it's not regulating your periods. It's shutting off your periods. My doctor also told me that these are the same hormones that I would need in perimenopause or menopause. They're not. They're synthetic hormones. They don't act the same as like bioidentical estradiol. They don't act the same as bioidentical progesterone. So they're not going to have all of those same like systemic health benefits. And in fact, they compete for the same binding sites in that. So those are probably the most common ones. And just make sure that we know, okay, I'm not ovulating on those things. And so I'm not getting my own natural hormonal production, right? So I think the biggest kind of thing comes in that situation right there, just not having that conversation. So I am definitely, like I said, not an anti anything, right? Anti-pharmaceutical medications, I think they can definitely loop in, but this isn't a problem with, like I said, the birth control. To me, this is a problem of lack of informed care, right? It's like, where are these conversations happening? Why do we not have women that have more options? And thankful to social media, I think there are more women out there that are like seeking this information, right? They're starting to ask questions. They're starting to really think like, what is best for me? And what is my body trying to tell me if I have painful cycles, I'm having heavy cycles, I'm having hormonal acne, I'm having hormonal migraines. It's like, what is my body trying to communicate with me? Is it, do I just want to come in and just shut it off? Just kind of shut it up? That's I think where the conventional medicine has gotten a little bit of a bad reputation, because it is more of a woman comes in and has more menstrual cycle symptoms, let's just kind of like shut her up and we'll just give her a pill to kind of shut it down, versus really having a conversation of like, Where are those symptoms coming from? Could this be underlying signs of something bigger going on? Do we want to really dig at the root cause, or do we want to come in, swoop in, and just kind of mask the issue and kick the can down the road and then just deal with this later, right? Because that's usually what ends up happening. So say, for example, it's a young teen gal that's having some heavy periods or painful periods, and instead of like digging in and understanding, we might just put her on a birth control. And now what we've done is we've frozen that like brain to ovary connection right there at that age, right? So then if she's on birth control for the next 10 years and decides to then get off of it and want to have a child, want to start a family, she just kind of like delayed all of those same things that were going on, and now she's going to have to deal with them when she comes off of birth control. That's usually tends to be the story of like, oh, I got off and they said it would just be easy to get pregnant, but like my periods are back in full force, they're heavier than ever, they're more painful than ever, now I have acne, now I have this. And it's like, probably was an issue then that we just kind of kicked the can down the road, right? Or we have the same issue, like we have fertility issues, right? We kind of like force around the equation to kind of get a pregnancy going, and then we get on hormonal birth control and kind of kick the can down the road, and now we end up dealing with it once we get into a perimenopause or a menopause picture, right? So I always just want people to know, like, hey, it's okay to utilize these things, but we want to kind of bring these pharmaceutical things in to make us feel better, like give us that reprieve right away. But then we also need to bring in the other side of the equation of like, what are we doing to answer the question of why these symptoms are existing in the first place, right? So I think this conversation can exist together, right? I think a perfect example that I'll give you, one of my clients, she's a mom, she works full time outside the home, she maintains the home, like the typical like woman having a lot of things on her shoulders, right? And she has some very heavy menstrual cycles, very painful cycles, getting migraines with the cycles, like to the point where like that week out of every month completely stopped her life, right? It's like she wouldn't travel during those weeks. She was planning her vacation and planning her life around her period. I'm like, okay, like we're going to get to the root of this, but it's okay. Like she felt guilty for utilizing a birth control in that method. I'm like, absolutely not. Like that's giving you your life back. But she was also wise enough to be like, I get it. Like, I understand, like, I feel guilty for utilizing this, and now I shouldn't feel guilty. But at the same time, I also want you to help me to figure out and understand why these problems are existing in the first place, so that I actually have an exit strategy if I want it. Because right now she didn't even feel like she had any exit strategy. It was like, this is my only option. And I don't want women to ever feel like it's their only option, right? So that could be one perfect example where it's like, hey, there's a gray area that exists here. Let's loop this in, because nobody needs to be literally like planning their life around their menstrual cycle, and not going outside the home, not going too far from a bathroom, like having to change a tampon, like a super tampon every hour on the hour. Like that's where we really want to come in and have this like, yes, we want to give you some quality of life back temporarily, even though we know that's more of a band-aid solution. And let's come in and really start to treat what is the root cause of this happening, right? So I think both of those can happen simultaneously. I do not think it has to be an either or. Depending on someone's situation, I think you could start and say, hey, let's come at more of a functional angle and try to attack the root cause first and see how far we get. I just don't think that there's a right or a wrong there, but I would encourage everybody to at least think about and question, like, okay, why am I looping in this birth control situation? What do I want to use it for? And what should the conversation be, right? So that's how I'm going to kind of wrap up our time here today, is really let's talk about the reasons why someone might utilize a hormonal birth control. And then let's also talk about like, what might that be trying to communicate to us from a body perspective, right? So let's kind of dabble into this gray area a little bit more. So for example, I would say like reason number one, someone might utilize a hormonal birth control. Obvious one, right? Contraceptive, pregnancy protection. Good on you. Way to be a responsible adult and have something on board. I totally get it, right? Not everybody is in a phase of their life where they're wanting to actively conceive or actively start a family. Totally fine. Completely valid reason to utilize a hormonal birth control, right? Now though, let's give a quick lesson of things that we weren't maybe taught about in school when it comes to fertility. If that is our only reason for utilizing that, right? We absolutely can, but where's the practitioner out there that's saying like, yeah, we can absolutely loop that in for just a contraceptive device, but there's also other options. Have you looked into those as well too, right? So when we think about fertility, women are only fertile for 24 hours in a month. 24 hours, right? Ovulation to when the egg is like literally the egg excreted from the female body, 24 hours, right? Ovulation, 24 hours. Now, sperm can live inside the vagina for up to 3 to 5 days. So the fertile window is usually about 3 to 5 days a month, right? Don't get me started on the soapbox speech then of like, so guys are literally fertile for 365 days a year, but women really only for like 24 hours. But yet we come in and we put something on our body for 365 days a year to like protect us. It's like, I feel like we're looking at the wrong thing here, but don't get me on a soapbox speech about that one. So when we think about that though, it's like, okay, so if I realize that there are other methods to track my cycle to prevent fertility that are non-hormonal if I want them, it's like, yes, we can track basal body temperatures. We can track cervical mucus. We can utilize some devices like Oura Ring, Natural Cycles, Temp Drop. I mean, there's so many cool apps out there now where women can actually like track and see, okay, here's my fertile window. Outside of that, I probably want to have some sort of either barrier system on board. Yes, condoms do still exist, right? Non-hormonal barrier method there requires both parties to be on board with that, obviously. But also recognizing like there is a distinct fertile window and I don't necessarily need to feel this panic. I think there's always this panic of like our health classes that are like, you have sex and you will get pregnant. Like you're fertile 365 days a year. It's like, let's not feed that. I think it's smart to have like safe sex education, of course, but it's like, let's teach women, boys, girls included to like understand how their body actually works, right? From a younger age and recognize how that can kind of be very empowering for women to be able to track their menstrual cycles, track successful ovulation, whether they want to get pregnant or not get pregnant. Things like that can be used for both halves, right? So I think that's really where the gray area comes in there for someone that's like, hey, I want it for just contraceptive purposes. Perfect. You can totally utilize it for contraceptive purposes. And there's also other options too, if you're interested. It's like, great. I still feel like the oral contraceptive is right for me. Fantastic. I just wanted to make sure that you had all the options before you made that decision. Hey, I appreciate that. Right? So that's a reason there. I would say reason number 2 or most common reason I see is usually to manage menstrual cycle symptoms. So heavy, painful periods, irregular cycles, unpredictable periods for any reason or the other. That right there is where the only problem that I have with that is that we're putting a guise on like, what's the real underlying issue? Like, what are we trying to mask by utilizing a hormonal birth control in that situation? So yes, usually when we start to see things like that, we do want to rule out like a PCOS or a polycystic ovarian conversation. We want to rule out like an endometriosis conversation. I have seen that time and time again where women aren't even diagnosed with that until they're trying to conceive. I'm like, oh my gosh, like they're like, yeah, I had really bad menstrual cycles as a teenager. And then I just got on birth control and then I tried to get pregnant. And I'm like, well, you probably had that picture and should have had that conversation at age 14 versus trying to deal with it now at 25, 26, 30, 35 years old and you're trying to conceive now. It's like, now we got some work to do to really dig at the underlying root issues of where that diagnosis would be coming from and try to support that better, right? So that's kind of where it's more of the picture of like, did we rule everything out? Did we really talk to that individual about, hey, we have this menstrual cycle. We have estrogen and progesterone, they yin and they yang throughout the front and the front part of our menstrual cycle and the second part of our menstrual cycle. And sometimes those heavy, painful cycles can really be a sign of an estrogen dominant situation. So it means that we're not producing enough progesterone to offset the amount of estrogen in the system. And things that can impact progesterone levels: nutrition, stress levels, movement, gut health, right? So it's like, why are we not talking about those types of things, especially with like young active females that have a great capacity to regulate their hormones? Like, they're not in a menopausal place anymore. It's like, we have the capacity, let's use it. Let's teach this female how to really work with her body and not just shut it off and then kick the can down the road and create a problem for her to deal with in the future. Right? So that's where I think from like heavy, painful, irregular cycles, there needs to be a conversation around like full labs workup. Are we ruling out things like a PCOS? Are we ruling out things like an endometriosis? Are we having those conversations early about how nutrition, lifestyle, stress management, gut health play into our menstrual cycles? Because a lot of times even like blood sugar imbalances can really exacerbate cramping, heavy cycles, irregular cycles, and all that stuff too. So the natural world can succeed here. We don't have to just shut off that connection, right? And then I would say maybe the third most popular reason here is going to be things like acne, migraines, right? Some of those more cyclical symptoms that show up and they just don't necessarily want to deal with those hormonal breakouts or like the migraines that ensue. Same conversations apply, is helping them understand like, okay, we can absolutely come in with a birth control situation and kind of just shut all of those hormones down, is really what we're doing. Most of the time it's like, we can bring in hormonal birth control to regulate your cycle, but it's like, let's call a spade a spade. Let's bring it in. It's like, we can shut all those hormones down to minimize some of those symptoms. But I just want to make you aware that we'll probably be kicking the can down the road a little bit, because that's going to then set up a picture where you're going to have to deal with like the root cause of the acne and the migraines that are causing this later on. Like if you ever try to come off of birth control, all of those things will probably come back with vengeance, right? So I just want to warn you about that, so that way you feel like fully informed. And for some people, they're like, you know what, I'm in a season of life where I don't have the capacity to think about that. Like, I just need it gone. I'm like, cool. That's where the pharmaceuticals can come in and just make it gone, right? But just making sure that we recognize that we didn't necessarily create a healing picture. We just kind of muted it for now, right? So lots of different things that can kind of impact this entire picture. And we really want to make sure that we're taking the time to talk about it, to educate individuals, to not just have like a one-sided type conversation, but to really let people live in the gray area. And I don't want women to walk into a practitioner center and feel like, oh, I need oral contraceptive, or I need a contraceptive. I have heavy, painful cycles. I have acne. I have migraines. I have like all of these things. And like their only option is given a hormonal birth control. That's where I feel like we're limiting ourselves and not having those types of bigger, higher level type conversations, right? So some really great questions coming across here that I'll try to just answer pretty quickly, even though I couldn't possibly get into all of these. Great question here on, don't we want to treat the cause rather than the symptoms? Would that be better? Yes, 100%. But sometimes individuals don't necessarily have the liberty or the luxury to have the capacity to work on some of those things. Like there's a mental component here too. So if somebody is, like I said, debilitating fatigue, losing, like I said, a whole week out of their life every single month, like there might be a point where it's like, okay, I need to put some Band-Aids in just to give them some mental capacity to be able to work on some of the nutrition and lifestyle changes here that are going to be required. So yes, we absolutely always want to go after the cause. Would be better than just Band-Aiding the symptoms. But sometimes giving people some symptom relief gives them some capacity and some fortitude and some resiliency to be able to work on the root cause, right? Because it's not an overnight fix, and that's okay. We just want to make sure that we recognize kind of like, it's not an overnight fix, but it's a forever fix type of thing, right? So you kind of get the benefit there too. And then I had another great question coming in around the role of nutrition and endometriosis. If you go back to a previous Learn with Lo series, I don't remember what month I did it. I believe I might have been March. I have a whole Learn with Lo about endometriosis, estrogen dominance situation, and how we really look at that from a more functional perspective. So go check out that Learn with Lo with endometriosis, and that'll talk all about estrogen dominance, toxin exposure, liver detoxification, gut health, all of that good stuff too. So, if you, like I said, are thinking about some of these menstrual cycle symptoms, or you feel like this has been a story for you in the past and you're either curious about your own journey with utilizing hormonal birth control, or you have a friend that you feel like could benefit from this, obviously please forward this on to them and share. But I would 100% first and foremost, get some labs, get a workup here. It can get as basic or as detailed as we can get to really start to get to like, what is the picture, the underlying like idea or root cause. So I would say for sure, if you're going to do some like serum labs or some blood labs, we definitely want to be looking at some blood sugar markers, because that could be indicative of inflammation. That could be indicative of some kind of like insulin resistance or some kind of PCOS picture that is fueling some of these symptoms or these menstrual cycle challenges. I also would look into getting some like micronutrient testing, whether that's some B12, some homocysteine, some vitamin D levels. I would also definitely look at getting a full thyroid panel. Thyroid can play very, very tightly into a woman's menstrual cycle as well. If you want to get more detailed, I do tend to recommend getting into more of the functional panels, like maybe like a Dutch panel. It's a dried urine analysis test where we can look at sex hormone metabolites, as well as a cortisol awakening response throughout the day. You could even go as far as doing like some GI map testing, especially for individuals that have more of like an estrogen dominance based symptoms or have been dealing with these for quite a while. So, I mean, labs run across the board. All the way from blood, all the way from urine, all the way from stool testing. So there's lots of different things that we can take a look at nowadays that don't just like handhold people to just one solution. And I think that that's like the biggest take home message, is recognizing that it's not a one size fits all. You don't have to just walk in and accept that it's like, oh, birth control or bust. You don't have to accept like just band-aiding your solutions and kicking the can down the road and saying like, oh, I guess I'll just deal with it later when I want to conceive, or deal with it later when I am perimenopausal or menopausal, because there's still a lot of things that are happening underneath the surface that we're just delaying the inevitable, sort of, so to speak, and can lead to, like I said, some bigger issues down the road. So it's not, like I said, a one size fits all approach, but hopefully that was helpful for just thinking through that kind of hormonal birth control side of the journey. So if you have anybody that would benefit from this, please feel free to forward on to them. If you are kind of thinking about your own journey, or it's got your wheels turning a little, what might be the right avenue for you, please don't hesitate to reach out. You can click the link in my bio. There's an application there to work with me one-on-one. I also cover a lot of this information in my Revive, Restore, Renew You 16-week hormone healing program as well too. So you can find links for both of those in my bio, and don't hesitate to reach out if you have any questions. So be on the lookout. We'll build on these conversations, because I know that there'll be probably lots of follow-up questions, which is great. And we'll tackle them in next week's Learn with Lo.